Hello, this is Dr. Emily Spence, and I am Associate Dean for Community Engagement and Health Equity. As part of our strategic plan, Impact 2030, we have launched the Community Core Initiative. The Community Core Initiative centers our community partners in everything we do. This includes the ways that we promote the education and skills development of our current and future workforce, the ways that we co seek, develop, and implement solutions for healthier communities, and the multitude of ways that we bridge lived experience, practice expertise, and research based evidence. What is the Community Core? It's a registry of individual people and organizations who develop formal partnerships with our school. These partners become involved in all aspects of our operations, including our education, research, service, and practice activities. Our collective work is designed to achieve our vision for Impact 2030, which is to see health equity in every community. You might be wondering what we mean by community. We define community as a collection of people with a shared interest. Communities can be place based, such as neighborhoods, cities, and other defined geographic regions. Communities may also come together through shared culture, interests, or goals. The pandemic highlighted the importance of online communities and allowed people all over the globe to connect with one another. Our community core is made up of people and organizations with interests, lived experiences, and expertise in areas related to public health. Since public health considers all of the influences on human health, the membership of our community core is open to a broad range of people and organizations, not only in the Dallas Fort Worth region of Texas, but across the globe. Thanks to technology, our partnerships extend far beyond our local region. The Community Core was designed by a task force of community members and academic partners. Through 6 months of focused dialogue, the task force developed the Community Core model. This model includes some very familiar components as well as some new initiatives that will require practice and learning on all of our parts. In addition to the Community Core being a registry of people and organizations, it is a governance process that will ensure our work aligns with 10 principles and values. These include number one, a focus on the sustainability of long term partnerships, two, co learning among faculty, community partners, staff, and students, three, high expectations for excellence and impact on community health, four, valuing cultural humility by practicing lifelong learning, listening, self awareness, and respect. Five, working together collaboratively to maximize our strengths and engaging one another for mutual benefits of our students and communities. Six, being accountable by taking responsibility for our actions and being transparent about our goals, progress, and outcomes, including being willing to learn from both our successes and our failures. Seven, ensuring that we remain community centered by prioritizing community needs through listening and engaging with residents about their unique strengths and challenges. Eight, promoting health equity by prioritizing policies and practices that contribute to fairness, access, participation, and equity in health outcomes. Nine, valuing transcendence by recognizing that public health transcends all sectors, and we will leave behind processes for others to scale, adapt, and improve. And finally, 10, we will share power, influence, and resources to equitably support mutual capacity building. When you examine the key roles of community core members, some may seem very familiar because they are activities that we and many others have been doing all along. The difference is that traditionally these activities are initiated by individuals and are sustained through their relationships. What is new is the resource support and structure we are building to facilitate these roles as part of the daily practice of our school. Our community core members will work with us to inform public health policy and practice and to set strategic directions. They will play crucial roles in the education of our students through co-teaching and adjunct instruction of courses, as well as class guest appearances and service learning project partnerships. Community core members will work alongside our faculty, staff, and students on participatory research, evaluation, and community assessment studies, and will co-facilitate special projects such as sponsoring conferences and workforce development initiatives. When we pull it all together, the Community Core is a model that is administered through a governance board that is co-chaired by a community member and includes representatives from the Community Core Registry, public health faculty, staff, and students, and Health Science Center colleagues from outside of our school. Through planned training sessions, committees, and dialogue between academic and community partners, we foster co-learning, co-mentoring, and partnerships. These partnerships will drive our curricular research and workforce development initiatives. Ultimately, the Community Core is designed to promote alignment between the needs of our community and our educational offerings. We want to ensure that we are responsive to the professional development of the public health workforce, and we want to see community-driven solutions that help us materialize our vision for health equity in every community. At this point, some of you might be wondering how to become a member of our Community Core Registry. The first step is to consider your own areas of knowledge and expertise and how these can relate to the health and well-being of people and communities. The next slide includes examples of these types of skills and knowledge areas. Next, you will go online and submit an application through our Qualtrics survey. You can follow the QR code on the screen or download the PDF version with the link. Next, you'll be able to receive a follow-up email requesting your resume and any other related information such as website links or other biographical material. The Community Core Governance Committee will then review your application package and make a determination. Since the Governance Committee meets every other month, you should expect a decision within about 90 days. We will then ask you to complete a brief orientation and provide information about yourself to share with our public health team members. The skills and competencies of public health practitioners is very broad, so you may have areas of expertise that you don't think of as explicitly health-related, but are actually foundational to the public health workforce. This includes leadership skills, the ability to mobilize community residents, and the capacity to customize messages for different audiences, from online social media to governmental decision-making bodies. It also includes the ability to use data for decision-making in organizations and other community settings. Sometimes this is done in traditional epidemiological settings, but in larger community systems, we gather and use data from school districts, health systems, nonprofit organizations, criminal justice systems, and so many others. We love our data visualization experts too. The ability to turn data into graphs that are easy for people to use and understand is truly both an art and a skill. Public health practitioners assess communities' assets as well as their needs. They evaluate programs, they design new programs, and they lead teams of people. Finally, I'd like to highlight the very important knowledge dimension of lived experience. In public health, we recognize that both scientific data and experiential knowledge is essential to being able to design and carry out interventions that will improve community health. People's lived experiences may include their knowledge of culture, a geographic region, what it's like to manage a chronic health condition, how to build trust in a community, or many other areas of expertise that are needed to promote health equity. At the University of North Texas Health Science Center, we recognize that multiple perspectives enrich and strengthen the work that we do. Being better together is one of our core values, and we look forward to living that value through our Community Core.